All right, everybody, I've given it a full additional minute and my phone now says it's 2:01, so we're a little past time. I want to thank everyone again for joining us for our first town hall associated with electronic visit verification for the new year. We first started these town halls, believe it or not, November of 2000, what is it, 2022, 2000 and we've been doing this for 12, this is our 14th month doing EVV town halls. So thank you for joining us in the new year. It's been a lot of town halls. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Compliance here at the Department of Community Health. And I've been working on the electronic visit verification system for around 3 years now, probably a little bit more than that when we did town hall meetings throughout the state. I know that was well in advance of the public health emergency, so probably about 3 years ago now. We start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do some project updates. We're going to do some case management and/or support coordination, frequently asked questions. We're going to do a little bit of a GAMMIS overview because we're getting a lot of Georgia Medicaid Management Information System questions. We're going to talk about some other common issues or questions associated with EVV. We're going to give you guys a third-party EVV vendor update. And then as time permits, we'll do a little question and answer session in the chat box. So let's start with EVV project update. I'll let you guys know today's presentation is not super long, so we should have some time for Q&A. But it does go over all the important pieces. So where are we? The system first went live back in April of last year. So April 2021, the system went live and it was available for use for PSS and CLS by all providers. We delayed mandatory implementation for a few times to get some system issues changed and give providers a chance to get trained and fully on board with the system. November 1st, 2021, providers by policy were required to submit their claims through EVV and not use GAMMIS anymore. As of January 1st, 2022, 2 months after the policy mandate went into effect, and April, May, June, July, August, September, October, November, December, a full 9 months after the system was operational and ready to use, we put on a mandatory claims edit onto GAMMIS, requiring that PSS and CLS providers utilize the EVV service, which is required under the federal mandate for certification. So this is not something we're just choosing to do. It is a policy point that's associated with certification. So as of January 1st, 2022, claims do need to be submitted through the EVV system, whether you have a third-party aggregator or you are using the EVV system, it is a requirement. Now, we're going to give you some statistics out there. 80% of providers as of January 1st were signed up to use those systems that were CLS and PSS clients. Still had about 20% of providers out there who had not registered. We have heard from many of those clients already that have said, I mean, many of those providers already that have said, hey, I know you guys were up and running back in April, but I just never started with EVV, and they are starting now. They still have a mandatory claims edit, so they're working in earnest to get their IDs registered, their staff in the system, and get all of their member schedules updated so they can start billing EVV. Now that 80%, it seems like, well, wow, 20% of providers. We have several IDs in the system, probably a significant percentage of which, where although they're registered to be a Medicaid user, they don't have any Medicaid members. We also have providers that have multiple IDs and are billing out of one ID location. If you are one of those providers, I want to encourage you very, very, soon, as soon as possible, it should be a priority for you to start billing by your provider location ID. That is a policy requirement. You're not supposed to be billing all of your claims out of one ID. You're supposed to be billing for the members serviced by client ID area. So it's really important that if you do have those other IDs out there and you're not using them and you're not billing for your Valdosta location for your Valdosta members or your Waycross location for your Waycross members and you're billing everybody out of your Atlanta ID, that doesn't comply with policy. So you need to go back and refer to the policy manual and make sure you're doing that appropriately. We have 1.6 million completed visits using EVV for PSS and CLS services in Georgia. That's a lot of completed visits, verified, completed, matched visits, 1.6 million. So a lot of successful, completed, compliant visits in our EVV system. We have 840,000 claims that have been submitted through EVV to GAMMIS successfully. So that's about half of our captured visits. And that's from before when we had the claims edited in. But just so you guys are aware, 840,000 claim visits have been successfully completed. Sometimes you guys will send me emails personally, and I totally understand you're frustrated and upset and you've got a learning curve, but you'll send the email and say, nobody is using the system doesn't work, nothing's working well about the system. Well, 1.6 million visits have been completed in the EVV system and 840,000 claims have been paid correctly. We have one provider that has submitted over 48,000 claims through the state EVV solution. Utilizing TELUS, they have been paid for 48,000 claims. So let's talk about the issues we still have and some exceptions to the January 1st mandatory claims deadline. If you have a member that has a cost share, you're in CCSP, which is, I think, the only place where we have cost share, maybe a few in source. I know there's not any in ICWP, and there was one member in comp, but they did not receive CLS. So this is really only relevant to CCSP and source where there are cost sharing clients. If you have one of those members and you utilize and bill on a daily basis for cost share, so on the first, you bill your cost share claims. On the second, you bill your cost share claims. On the third, you bill your cost share claims through EVV. Patient liability will calculate correctly. If you span bill from the first through any period of time, the claims won't process correctly. We are working furiously on this right now to get the claims submission fixed so this isn't a problem ongoing. If you do bill in span billing, you'll need to bill those claims through GAMMIS. They will deny for the EVV edit. You take that ICN and you submit it to the evv.medicaid@dchga.gov, and we will override the claim so that you can go ahead and get paid for that. So that is not a problem at all. Just submit that claim for GAMMIS, let it deny, and send it on through to us, and we will override the claims issue. The other issue is if you have a tier 2 ticket open with NetSmart, you've called the call center, they've given you a tier 2 ticket, and they can't resolve your issue. You can also go in, bill those claims through GAMMIS, and then send those ICNs to us, and we will override the mandatory claims edit to bill through GAMMIS so that you can be able to get paid. Now, we're only overriding the EVV edit. So if it hits another claims edit in GAMMIS, like you've run out of units, or your PA is not active, or whatever, those edits will still post. but we will make sure that the claims are processed through GAMMIS. This is the process written out. And again, we will post this presentation as we have done. Just so you guys are aware, this is also a banner message. We put out a banner message on GAMMIS on 1/6/2022 that outlines this process in the same manner that's on the slide and what I just went through, so that you can follow the process to get those overrides done. Okay, let's talk a little bit about case management and support coordination. The functionality for case management is a view-only access, and it's linked to the members your agency serves under case management or support coordination. So it's a view-only access. You don't have update access. You don't bill through EVV. I've had some case management companies come to me and say, hey, you know, I'm going to bill through EVV. That's not a functionality of case management or support coordination. You have only a view-only access. You're there as a tool in your toolbox to help you with the case management of the members that you coordinate with. So you'll be able to look at schedules, visits, prior authorizations. You'll have reports that can be broken down by what's going on with your recipients, visits, completed versus scheduled visits, visit detail, visit reports. So you know when somebody's late, when they're not showing up. We heard numbers on deauthorization this morning where there was a large number of units that were being measured and put in the system that weren't being utilized by the member. We've always historically had a percentage of those in the waivers. I imagine with the public health emergency and so many folks getting sick and being out of work who are aides and the trouble hiring aides, that's what's driving that number up to an additional amount which is higher than we've seen previously. But you as case manager will be able to see what are the visits that we're scheduling that are not actually being performed for your members. Another very big point is you will have the ability to send and receive messages to and from your aides. And that's right there in the system where it says send message to users. Again, we talked about a few of these. EVV is not required for case management or support coordination. Case managers access this EVV solution by registering as an agency first and then adding their employees. It's actually like an invite to your employees. Once you put them in the system, they get an email, they accept the invitation within 36 hours, and then they are in the system. If they don't accept the invitation within 36 hours, you will need to call the Georgia the call center to get reset the temporary password so that employee can accept the invitation. We do have a provider checklist on our website, which is right here. We'll provide that link for you, but the easiest way to get to it is to go to Google and put in DCH EVV GA, and it's the first thing that pops up. So it does the functionality. Another question we get is this just for case management or does it apply to support coordination? No, both. It's a tool for both of those case management functions. Support coordination and case management, they're the same thing. They're case managers for the waivers as required under the waiver. So it applies to both. It is a toolkit for both. If you have providers that are coming to you in your support coordination and saying, hey, I'm still got a lot of questions about EVV. Is there any way you can help me? Absolutely there is. There is our website that has a breakdown of different checklists on how to use TELUS, how to use a third party, whether or not you're using a third party system or the TELUS solution itself. If you register as a case manager and it says, hey, you have a provider administration role and not case manager administration role, is that a problem? Yes, you should be in as a case manager if you're a case management agency or a support coordination agency. If you see provider administration, there's 2 steps you need to take. You need to make sure you're actually registered in the system with your case management ID and not another Medicaid ID that your agency uses for another purpose. If you still have confirmed that, yes, I've got the right ID for support coordination or case management, you need to call the call center, and the call center will verify for you and walk through what you need to do for next steps. All right, let's do a little bit of GAMMIS overview. So we're receiving several questions into the EVV mailbox that are really more GAMMIS basic claiming questions than they are EVV questions. It's really important to remember that as a provider, you should be looking at your remittance advice, your weekly remittance advice that shows you what claims were paid, what claims were not paid. It gives you all the information for you as a billing agent on a weekly basis. You need to be aware that GAMMIS is the system that does claim status review. Everything is checked up front with EVV, but then they pass the claims to GAMMIS, just as they always have been done, to do the complete claims adjudication process. So if there is a denial of the claim, you should be looking on GAMMIS to identify why that claim is denied. Over the past several weeks, I've got multiple questions from providers who have said, hey, EVV denied my claim. And I've gone in and looked at the claim and I've said, no, this isn't an EVV denial. This was denied because you ran out of units at the end of the month, or because you put in the wrong modifier that wasn't applicable to your PA. Like you put in T1029 and your PA has T1029 TF on there, or you used all of one of those T1019 codes and you didn't have any more left, so you needed to really, get that PA adjusted if it was appropriate to get it adjusted. So, make sure you're going into GAMMIS and looking and seeing what your denial reasons are on your codes, because a lot of time there's nothing EVV can do to fix those. If you need to void or adjust claims, you can do that through GAMMIS. I've had countless people contact me and say, I can't adjust my claims. Well, you can adjust your claims. So that is a functionality that exists within GAMMIS prior to 1/1/21. And after 1/1/21, if you're adjusting the units, we'll talk about that a little bit later. So that is functionality that exists within the GAMMIS system. You can also use the GAMMIS system to look at your service units and your prior authorizations. We get questions where people say, hey, my member's not in the system. And then we'll go and look and say, oh, there's something wrong here with the interface. We need to figure out what that is. But then we'll go into GAMMIS and we'll see the member's not in GAMMIS either. So make sure before you send in the person to say, hey, they're not in EVV, that you do know that they're correctly in GAMMIS. This is a spot where you can submit questions on any of these issues directly to GAMMIS, and those billers will, the billing specialist with GAMMIS will be able to help you with these questions. Okay, let's go over a few common issues and concerns. We are still getting a lot of questions around rounding rules. As a reminder, at the request of multiple providers, we implemented rounding rules for EVV and CLS and PSS. We use the Medicare rounding rules, which is up to 7 minutes, rounds down, 8 minutes or more, rounds up. For an hourly unit, which is just in ICWP for personal support services, less than 30 minutes rounds down, more 30 minutes or more rounds up. So what does that look like? Let us give you some examples. Aid 1 clocks in at 12:58 for a 1 p.m. shift, so they're a couple minutes early. They clock out at 3:10, so they're 10 minutes late. Maybe they were doing something for the member and they were in the middle of doing that. Maybe they were cooking for the member because the member couldn't cook, and they got done with the cooking the meals and it just took 10 minutes more than they normally did. Well, that equals 2 hours and 12 minutes, which equals 9 15-minute units, not 8 15-minute units, because we have rounded up by 1 unit. Another example, next day, let's just say it's the same person. Next day, different aide clocks in for this person. Again, they're 2 minutes early. but they leave only 5 minutes late. They were still doing something for the client, but they were, didn't take a full 10 minutes to do it. It took 5 minutes. So this is 2 hours and 7 minutes. That will round down to the 8 15-minute units. So I know a lot of folks want to manually adjust claims, and I've gotten some questions about, hey, the little pencil in EVV where you could adjust the claims unit is missing. That is correct. That is something we did at the request of providers. Providers repeatedly said to us, hey, we don't want to have to figure out how many units in these rounding rules. We just want to be putting in clock in and clock out times. So if you need to adjust the number of units, you need to adjust the clock in and clock out time, and the system automatically calculates the units associated with when you clocked in and clocked out. So that little pencil is gone for you to adjust units. You will have to adjust the time that is associated with the units. Now, you don't want to give somebody uncompensated care because that's against policy. If your staff were there working, then they should be paid for the units that they were there working. But your aide and your member needs to know that if they get 9 units instead of 8 units, that means somewhere down the line, probably at the end of the month, if you're CCSP or source, that you're not going to have a unit that you're used to having. And that aide will have to leave 15 minutes early because they used up those units early. So billing related issues, we went over this. You need to really look at what the claim status is on GAMMIS. It's really important. We have a lot of providers that are not really monitoring those claim statuses and looking to see if claims were paid, denied, and what the reason they are denied. If you have a cell phone and you're having trouble with calibration of your cell phone, you can call the call-in center, and the call-in center will help you. The GA EVV call-in center will help you to make sure that your phone is calibrated so that your clock in and clock out space is correct. Adjusted rates. This is a big issue right now. The elderly and disabled waiver and ICWP waiver received a 10% rate adjustment associated with the Appendix K submission due to the public health emergency. We understand what a big, huge thing this is for providers. That rate adjustment goes back to July 1st, 2021. We are in the midst of doing a mass adjustment for those claims. And right now, our #1 priority in EVV is to get the rates adjusted in the system for PSS. This is only for EDWP, Source CCSP, and ICWP. So we are working very furiously to get those rates adjusted for for PSS. We hope to have them done shortly within the next couple of weeks, hopefully maybe even before that. But we want to assure you that even if the rates aren't in there now, when we do the mass adjustment through GAMMIS, you will be paid for the differential between the current rate and the 10% increase. So the mass adjustment will catch your rate increase. And again, we are working furiously to get those updated in EVV as well as in the WellSky system for the prior authorizations. Last frequently asked question reminder, the claims submission deadline is now Thursday at midnight as opposed to Friday at noon. So claims need to be submitted Thursday by midnight for the next week's remitted cycle, which is Thursday. Now, over the holidays, there were some errors with some automatic transmitted flight, not errors, but delays in processing of the submission of some EDI, electronic submissions of claims from providers all across the Medicaid system to GAMMIS. So it wasn't just EVV, it wasn't just the EVV system, it was hospitals, doctors, dentists, everybody. There were some delays over the Christmas break in those submissions. We do want to remind providers, although we at the state and GAMMIS do our best to pay you extraordinarily quickly in less than a week for claims submitted, which is, some states only pay once a month, but we pay every week and the week after you submit claims. The system actually has up to 14 days or 10 days, I'm sorry, my apologies, 10 days to authorize a claim. So it can take a little longer, an extra week, in fact, for you to get remittance for that claim that you submitted. It doesn't happen often, but it did happen a couple of times over the holidays for some providers. Okay, let's go over our third-party update. These are all the vendors who are 100% compliant with the EVV system. They're outside of the EVV system. I believe our system that the state sponsors is on here as well. But there are 34, I believe, that are now on here. And I think we may even have a 35th that we haven't added to this slide as of yet. And we have a couple more that are still working through integration. So you have multiple avenues for becoming compliant with the EVV system. If you don't want to use the free Georgia NetSmart TELUS system, which is on here, it's right under my EVV here at the bottom. I'm sorry, I didn't mean to do that. Then you can use any of the others and they should integrate with the EVV system because they have been through the testing process. Okay, I'm gonna remind people one other things here at the end before I look and see what's in the chat. And that is that the Georgia call center number for EVV is 833-701-0012. And the email address is gaevvsupport@conduit.com. It is important that if you want to get one of those tier 2 tickets open, that you contact the call center. They will try and resolve your issue while they're on the phone. If they cannot resolve the issue while you're on the phone, they will open a tier 2 ticket. And with that tier 2 ticket, you can submit the denied claims from GAMMIS to the EVV mailbox, and we will process them as shown on the 1622 banner message. I'm getting a lot of folks, a lot of providers that are personally emailing my personal email address, just fine, it's open, it's out there for everybody. I put it in a million presentations, or the EVV mailbox. All I do with those is forward them to the GA call center and ask them to contact you and try and resolve your issue, and if not, open a tier 2 ticket. So sending me the information is really just delaying you getting the claims processed. And I don't want you to do that. And I want you guys to know, I get over 300 emails a day. It's somewhere between 300 and 500 emails. I am much more likely, because I'm not the only one looking at the mailbox anymore. I have staff that are monitoring the mailbox as well. You're much more likely to get a faster same-day response from the Georgia call center than you are from directly emailing me. So it's really, really important that you call the call center and at least make that first contact so they can open a tier 2 ticket. All right, let's see what is in the chat mailbox. Overlapping members with T2025 U4UN. Yes, you can submit these claims now. You should get a warning message, but the claims can still be submitted. There is a link to case management that Brittany put in the chat. If nobody has gone in and seen it, please look at the link to the case management chat. It's really important in there. Should we continue to build structured family caregiving without cost share on EVV? Structured family caregiving is not an EVV service. It does not go through EVV. So you should be billing structured family caregiving, as you always have, through GAMMIS. Just this week, I am not able to edit the rates. That is correct. You cannot edit the rates. You can edit the clock in and clock out time. So you can edit that clock in and clock out time. You cannot edit the rates. You cannot edit the number of units. Those are automatically calculated by the system. If you're having trouble editing the clock in and clock out time, then you should contact the call center so that they can help you. What does entity code mean? The entity code means who you are, I believe. You'll need to send that to the EVV call center, Ms. Williams. We can have somebody help you specifically with that training. I'm not as familiar with that, so we're going to have somebody help you with that one-on-one. Will adjustments be seen on our remittance advice when they are completed? Yes, because the adjustments go through GAMMIS. Why is there so many problems on a regular basis? Clients there and then are missing PAs. Well, we talked about this. So your reality of clients missing on a regular basis, that's something we need to investigate and solve. But again, we have many providers that are successfully billing all of their claims and have all their members. So if you have PA members that are missing, I am in no way saying that it is your fault. I am saying we need to follow the process to make sure we are getting an understanding of why you are having so many problems and receiving problems on a regular basis. So please do engage the call center and make sure that we are following up on that so we can get solution to your issue. You have a tier 2 ticket that has been open for months. Clients are not in the app. Again, that's back to the other one. We will work through those. We're trying to expedite our review of them. We have both NetSmart and GAMMIS working together to look at what is in the interface file. There's some complaints about following up. Thank you for that. If the call center is not following up to your tier 2 responses, we will certainly pass this information on to our contract compliance people and the people at the call center. This is a question from an EVV vendor. How can you get tested and added to the vendor list? You need to go to our website. Our website has information on integration for third-party providers. You simply need to follow the website. Again, you can go into Google and put in GA-EVV DCH, and it'll be right there and pop up, and you'll see a little tab on your left that says third-party integrations. I could bill at the increase last week, but this week the claims are billing at the old rate. Will the claims post 1/1/21 be a part of the mass adjustment as well? You're going to have to send that to the EVV call center. I'm not aware of any rates in the system being reverted, so we need to investigate that if you are seeing that. Again, there's questions in here about the rates. We are in the process of updating the rates, and we will do a mass adjustment. You will receive your full 10% increase when that adjustment is done. Can EVV support me with the learning while I've hit on how to submit claims? Yes, you can call the call center, but I want to encourage you to the fact that there are multiple training resources that are available online. There are modules that you can video modules that you can stop and watch, and they're 8 and 10 minutes long on everything from resetting your password to how to submit a claim, how to do administrative work. There's manuals, there's frequently asked questions that are out there. This is a really good question because I think a lot of times people go, I don't know how to use the system. I don't know what to do. I'm going to email Brian and say, will you sit down with me and do a one-on-one training? Well, guys, there's 2,000 of you. And EVV is just part of what I do in a day. I do everything from prenatal to hospice, right? So it's just not feasible that I'm going to have time to spend a ton of time walking you through that. And that's why we set up all the multiple training resources that we have. That's why we have the videos. That's why we have the guides. So absolutely, you can call the GA EVV Support Center. I'm going to tell y'all a secret. We had them sit for 3 hours with one provider. 3 hours. To me, I start to go, now, wait a minute. 3 hours? But we had one provider that received 3 hours of training on one day on how to use the system. Why, if I bill this week, I don't get most of my funding until 2 weeks later? I bill before time. I don't know. You can call GAMMIS and ask them, and we can track it back to when you actually submit the claims. But 2 weeks is still within the required time for claims remediation. But it is pretty standard that if you bill before Thursday at midnight, that most of the time you get paid the following Thursday. So another complaint about the call center. Thank you very much for that. We will pass that along. What rate should the third party be sending over? They can send over the old rate or the current rate. It won't matter because the claim system still adjudicates the claim system. The GAMMIS, the EVV system is not set up for the new rate, but when we do the mass adjustment, it will pull through. So it really won't mess anything up if you go ahead and do that. Is it possible to have training with a third-party vendor and TELUS? So there, I see the question about, yes, the rates have adjusted. Feel free to send me an example and we'll research that and take appropriate action, whether action needs to be training with whoever or whether or not there is something in the system we need to look at, just so you're aware. Is it possible to have training with a third-party vendor and TELUS? Well, TELUS can train you on the administrative portal, but TELUS can't train you on your third-party functions because they don't know how the app for a third party works. But absolutely, TELUS can train you on the administrative portal, which is still part of the TELUS function. Okay, so if you are still having trouble with the shared services, then you can call the call center. If you don't have problems with the call center, then we can absolutely have one of our DCH staff do some corrective action with you and do some training with that. We'll absolutely do that. That's not a problem at all. We'll engage one of our DCH staff to really reach out to you. Marilyn Ellis has been great to do that in our DCH staff and walk stuff through some. One-on-one training is available if seriously needed, but I'm going to tell y'all something, and I'm way too honest on these things. We need you guys to do your due diligence. We need some sort of assurance that you have gone in and attempted to do the training on your end, and that you have watched the videos, that you've been engaged in the frequently asked questions, the toolkits, the guides online. I am getting, and this is not you who asked the question, so please don't take this as such, but I'm getting a lot of people who have not been engaged in the system at all right now. They are just now showing up here 9 months after we've implemented the system, in the 13th month into our town halls and training, that are now panicked and saying, I need a million support to get this done immediately, and I need step-by-step, training. Well, you had 9 months with the system up to be using it. And you've had 13 months of intensive training in multiple venues to use the system. So we absolutely, if there is just a hurdle you need to get over and one-on-one training and specific time that we will spend with you, we will. But we need to know that you're out there doing your due diligence as well, that you're making an effort. You need to know where the website is. You need to know where the training is. If you call and speak to me, because a lot of people call me on my work phone or my cell phone, if you got it, and you say, hey, Brian, can you walk me through X, Y, and Z? The first thing I'll say is, well, have you been to I'll give you a real life example. Somebody called me last week and said, there's no registration information on the website. And I said, I'm positive there is. So we got on the call with this provider and they Googled the DCH website, like I've told you to do. They clicked on the link. I was doing it with them on my computer at the same time. I said, scroll down, scroll down, scroll down. I said, it's right there. You see it? It's right in this section that says provider resources. It's number 2 at the top. And the provider said, oh my goodness, it is there. I guess I just needed you to hand walk you through it. I don't mind doing that if I need to do it, if I need to show it and my staff needs to show you to do it. But I'm pretty sure that provider really hadn't gone in there and looked, or if they looked, they didn't look real well, because we both found it in 2 seconds. So please just do your due diligence. And I don't know who that provider was, and I don't blame them. I knew they had a lot going on. They were panicked. They had missed everything about EVV, and they were just trying to get registered. So I'm not mad at that provider or upset with that provider, but I do want to make sure folks are doing their due diligence. Okay, a couple more questions and then we'll move on. If there's a problem between your third party and TELUS, you can outline what that problem is to the EVV mailbox. And what we have done is we have gotten the third party and TELUS together to do research at the same time. We don't have any control over your third party that you have chosen. Our choice for you is to use the state-sponsored system. It's actually extra work for everybody to have these third parties for the state. And it's why many states don't allow you to have a third party. They give you one option. They say you will use the state-sponsored system. But in this state, we're allowing you an open model. So I can't make the third party do something, but I can definitely have us and TELUS and the third party all in the same room so that the finger pointing stops and saying, it's not my problem, it's their problem. So yeah, you can send that to the EVV mailbox and we will facilitate that. If you have a caregiver that did not clock in correctly or missed several visits, you can adjust that on the EVV administrative portal. If you need help with that, please call the call center so they can point you to the appropriate training modules so you can learn. Thank you very much to Brittany, who has put in training sessions. Thank you for reminding me of this, Brittany. So one last thing before we go. Guys, there is a NetSmart sponsored weekly training that is online that you can attend, which is what Brittany is posting right here. You can ask whatever questions you want in that training one-on-one directly to NetSmart. We have very few providers that take advantage of that. So please, 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 if you are having issues, utilize this link, register, and get your questions answered directly from EVV. Okay, that's it for today. I have another request. I'll take that. We'll certainly take all your questions and comments into consideration. And we really do value your Q&A. I want to make sure you guys know that. The system would not be in the state it is now without all the valuable input from providers and members. I speak to a lot of members, especially consumer-directed members. So I do want to thank you for the information that you continue to send our way. Please continue to use the call center and the EVV mailbox as necessary. Thank you for your continued participation in the EVV program and in Medicaid. It is valuable and incredibly important. I hope you have a good day and a good rest of your week. Thank you.